Welcome to another one of our Royds with E. King Herbs Palsy webinars, this time dealing with all things related to physiotherapy and in association with the Herbs Palsy group. I'm Paul Rumley, lead partner at the Clinical Negligence Department of Royds with E. King and a specialist in handling claims on behalf of people with Herbs Palsy. I'm joined by my colleague, Lucy Norton.
Hi, I'm Lucy Norton. I'm a senior associate at Royds with E. King in the Clinical Negligence Department. I also specialise in Herbs Palsy cases and birth injury, including cerebral palsy as well.
Thank you, Lucy. And doing this webinar in conjunction with the Herbs Palsy Group, which is still the only national charity dedicated to Herbs Palsy. We're also extremely fortunate to be joined by Kim Hawksby, who has been a member of the Herbs Palsy Group since being a child and who takes an active role in the work of the group. Kim regularly speaks at the Herbs Palsy Group's Professionals Conference, which is designed to educate midwives and therapists about the true impact of having Herbs Palsy. Kim has worked as an occupational therapist, specialising in orthopaedics and trauma, paediatrics and elderly care. Both being an occupational therapist and having Herbs Palsy herself, Kim is able to give us both a personal and a professional viewpoint during this webinar. Welcome, Kim.
Hi, thank you. Hope you find this webinar informative and useful.
Thank you, Kim. And we're also very lucky to be joined by Susan Filson, who has been a qualified physiotherapist for over 40 years and has worked extensively with the NHS at some of England's largest hospitals. She was a director of physiotherapy and oversaw both adult and paediatric services, including medical, surgical, and neurological injury rehabilitation. As well as currently consulting and treating patients, Susan has been involved in researching the benefits of water therapy, hydrotherapy, and swimming, plus the suitability of disabled access to leisure centres and swimming pools in Great Britain. As an expert in her field, we therefore welcome Susan to share her views and knowledge about physiotherapy generally and in relation to Herbs Palsy injuries. Welcome, Susan.
Hello, everybody, and thank you for inviting me to talk tonight.
You're very welcome, Susan. And most importantly, we have David, whose son has Herbs Palsy and whose claim we are currently progressing, to talk about the challenges that they as a family and their son have and continue to face with Herbs Palsy. To preserve anonymity, we're going to refer to David's son as B or your son throughout. But I can confirm that their son is 13 years old and has a grade 2 brachial plexus injury affecting his left arm. This leaves B with a significant permanent reduction in range of movement, grip strength, and function of his left arm and hand. He has not had surgery, but has received physiotherapy and hydrotherapy treatment whilst growing up, and his parents have actively encouraged him to participate in all sorts of sports to maximise his potential. David, thank you very much for joining us this evening and for giving us the parent voice, which is very important in this discussion. So welcome, David.
Thank you, and thanks for the invitation.
So again, Susan, firstly, very simple question, actually. Can physiotherapy assist with pain levels?
The exercising and the movement keep the limb as supple as possible. Therefore, the nerve endings don't get tight in scarred tissue. So the less you move it, the more scarring is involved, the more the nerve endings are in that scar tissue, and that causes pain. And then if you stretch the scarring, you've got pain. So from an overall basis, the more you use it, the less of those sort of pains you get. But it is painful because the nerves are not, you've got abnormal sensations. So again, warm water is very helpful. So being hydrotherapy, just lying in a warm water or a warm shower, or just having some massage in the tight areas just helps the painful symptoms. I think Kim said acupuncture. So all these things are around physiotherapy. They may not be true physiotherapy, but there are other holistic treatments which are very useful. But I think the pain has to be managed the best way possible, yes.
B has pain on occasion. You've mentioned back pain previously. What does he do to manage that? Does he use his sport as a pain management, or does he, have hot bars or paracetamol? How does he deal with his?
Yes, on occasion he has the paracetamol to assist, to ease it. But we've recently got him a massager. It's one of these ones. It literally is like a collar, goes around the neck. You put your arms through. You pull down on your arms where your arms are in the sleeves, and that produces the more pressure. So the more you pull, the more pressure it puts on the area that's massaging. And he uses that quite a lot when he's having moments where he feels a bit stiff in the shoulder or around his neck. He uses this. And it does quite effective because it heats up as well as obviously massages the area at the same time.
Moving on, Kim. Now, with your unique approach professionally and personally, and appreciated that you've had surgery, have you ever tried other therapies? And if so, did you find that they helped or hindered you?
The surgical option was definitely a really good option for me, and I've had many, many benefits from the surgeries that I've had. But I think it's such it's not a one thing fixes everything approach, herbs palsy. And, you've got the surgery and the physio, but you've got lots of other stuff. Obviously, I'm going to promote the occupational therapy side of things. A lot of the time, just from an advice point of view, just kind of looking at, how different ways to do a task, kind of what aids and adaptions are out there, just from that pure advice, your occupational therapist can be really beneficial to have. My OTs, I have lots of different splints that make it so I can do different functional tasks a lot easier and in a lot less pain. And I also see the occupational therapist for elbow extension cast. So I had quite a bad elbow contracture, which kind of improved after some surgery, but to maintain the range that I've got, I sleep in an extension cast. So that is kind of very fortunate for me that I've got that. And that I don't get the contracture back. So obviously that then affects function, and also kind of the pain increases with that. I have had acupuncture before, but it's always been as part of physio. So it's been difficult to know whether that just alone kind of helped, or, was it the kind of deep tissue massage and the other kind of input at the same time. We have lots of people in the herbs palsy group that, see osteopaths, sports massage therapists, just go for beauty massage, just for that, for a kind of soothing. There's lots of people who are trying kind of alternative things now as well and getting the benefit from that.
Again, in your unique position here, and you've had surgery, was your pain different before versus after surgery? And has physio played any part in your pain management?
I think surgery has definitely helped pain-wise. I have quite a significant injury with very kind of poor function on my right side. So I was quite late getting in to see a specialist and had surgery quite a lot older than the norm. I had my wrist fused when I was 12, and then I found that if I did hold something in my palm, it would put some pressure on my wrist, and because my palm was facing upwards, it used to be quite uncomfortable. So although it had benefited and I'd got a bit more function, there was a different element of pain there. So when I was 17, I had my bicep muscle rerouted, the Zancoli procedure. So now my thumb points upwards and it puts a lot less pressure on my wrist when I'm holding things. So that made a big difference just day to day, pain-wise. And then I had the latissimus dorsi transfer when I was 27, which is quite old compared to when children normally have it. And I am told it's much easier to have it as a child, and that I wasn't being a wuss. And the main reason why I had that was for pain. So I had a lot of problems with my shoulder, so it often gets very elevated. and I was just struggling kind of posture-wise, having to have physio, very regularly to just help with the shoulder. And the surgery that I had on my shoulder helped really manage the pain a lot better. And again, it's one of those things that you don't often realise what you're struggling with until you then are not struggling with it. So I have a lot of problems on my left side, and like we said, kind of a lot of back pain, shoulder, neck pain. But just as an example, before I had the latissimus dorsi transfer, every time I wash my hands, because I can't turn my hand over, I would literally have to turn on my side like this. And obviously I was working on the wards, so the amount of time we're washing his hands, and to be putting your body in this position. And then after the lat dorsi transfer, I can now kind of stand and put my hands straight in front of me, and my posture is much, much better, and that just has much more of a knock-on effect on all your other joints, not necessarily kind of just the right arm. And again, physio-wise, my main reason why I go to physio is for pain management. And again, a lot of the problems is my shoulder. So when my shoulder gets tight, because I've got no active range in my shoulder, I use my whole shoulder blade area to elevate my arm. So I get a lot of tightness around my shoulder blade, scapula, and up on the front, and really tight across here. So I have a deep tissue massage. And I also have taping, which I can now, as you can see, I've got some tape on at the minute, to help the shoulder kind of come down and back, so it's not kind of dropping forwards. And that is really kind of useful for me and helps kind of with the overall pain management side. And again, I see the physio for the issues with my left side, which has become much, much more of an issue as I've kind of got older. The Herbs Palsy group definitely are much more aware that pain is more of an issue than what it was really previously kind of acknowledged. And it is unfortunately one of these things that as people with Herbs Palsy get older, the pain kind of increases, and it's not always just through the Herbs Palsy side. It is, a lot of the side is through the unaffected limb. Luckily, there's lots more kind of surgical options now offered. So there's the better function in the herb side, which means they're not having to rely on the left side, the unaffected side as much now, which is a real benefit. But for us kind of old schoolers, where there wasn't much available when we were younger, and we have had to rely on our kind of unaffected hand, it's the wear and tear on this side now that's probably more of an issue actually to me now on a day-to-day basis than my right side is.
Sorry, one of the things the doctors don't notice, because they're so looking at the arm, and that actually people with herbs often that can have balance problems and low back problems, because you've got an abnormal posturing, and you're working so hard with the other muscles sometimes to do it. So we used to see people with other injuries, and it's something that I often put in my reports. And then the orthopod or the plastic surgeon sort of says, "Oh, no, I never see anybody like that." Well, no, you don't, because by the time people have got these problems, they've discharged them. And yes, you do have them. And so we see that as well. So there are knock-on secondary effects that are not necessarily around the arm, the shoulder, the neck, that need looking at, and I'm sure Kim will, the average that just aren't picked up sometimes, or just poo-pooed because, well, yeah, you've got a bit of backache, but it is because one bit of it is not working in sync with the rest.
David, as a parent of someone with Herbs Palsy, what's the best advice, one best bit of advice you've ever been given?
I don't think we have been given any advice, to be honest. It's been a massive learning curve that we've, it's through our own thing that we found the Herbs group, through our own looking and research, that we've come to understand the problems with herbs, and speaking to other Herbs Palsy sufferers or parents of other Herbs Palsy sufferers. But for information given to us, I don't think we've ever really had any real sort of input if you like, the specialist side of things, and the people who know, until we started with our case is when it all started to come to light with regards to information from yourselves, and for our specialists, obviously, on our side, who are fighting for us.
Just picking that up, David, so has the claim been quite a positive experience for you then?
Oh, yes, very much so. At first it was, there was always doubt in your mind whether you're doing the right thing or, what we're doing. But the experience, and obviously from yourselves and people that we've come into contact with as a result of it, our knowledge has just increased, massively. From what we knew from the very early days to what we know now about the condition, and we're actually able to pass that information on to people we come across as well. Who are just coming into the system with regards to their poor child that's got herbs, and that's where we've been where we're part of the Herbs Palsy group, and we go on there. They have their family fun days and things like that when they have them every year or whenever they can. And, we've been to several of them, and sadly, people are still coming into the system where their children are still suffering. And it's nice to be able to pass on our knowledge and understanding of it to them,
What top tips would you give a parent or a child who's got a diagnosis of Erb's palsy?
Perfect. Kim?
Say for a family, I think it is very similar to kind of David. There is times when things are tricky, and things are hard, and I think it's very important to also acknowledge that. But, if you can try and have it, normalise things and do things in a way that really kind of encourages the child to be the best version of what they can be, really. Find something that they enjoy doing, that will help with the physiotherapist. So we've talked a lot about sport. Kind of instruments is another big thing. So, I know someone who uses drumming, as their way of kind of therapy, and their passion, so there's lots of different things as well as sport. But if you enjoy something, you're much, much likely to kind of do it. For the overall picture, I kind of just think be aware of not just the affected side, but look at the whole kind of body, look at things like not overdoing things with the unaffected arm, because in the long run, that's then going to cause problems. For people with it, don't ignore pain or difficulties. There's lots of people that aren't still seeing one of the specialist teams, and we always say, to get the benefit of that, see the specialist consultants and the specialist physiotherapists and occupational therapists and psychologists. They're kind of the experts in the field, so don't kind of struggle along. Sometimes you kind of get used to pain because you've kind of had it there, and sometimes you just kind of almost forget that actually there might be something that might help as well. So don't kind of just put up with it. And also, just for parents and for someone with Erb's palsy, don't be afraid to ask for help. Whether for whatever reason, either from the Erb's palsy group or kind of from health or getting kind of psychology support. It's a very hard disability. There's lots of things that it encompasses, and it can be challenging, and it's important to acknowledge really what impact it does have on everybody, and to deal with that and get the right input that's needed for that.
I hope that the people watching will agree that we've covered a very wide range of practical issues, and so we hope it is of real help to people with Erb's palsy and their families. So it remains for me to thank very much Kim Hawksby of the Erb's Palsy Group, Susan Filson, our expert physiotherapist, and David for all of their helpful insights. If you want any further help or input, please go to roydswithyking.com or erbspalsygroup.co.uk. And thank you for watching. So, Kim, what are the benefits of joining the Erb's Palsy Group?
There's many, many benefits of joining the Erb's Palsy Group, but I think the main thing is that everyone involved with the person with the Erb's palsy knows that they're not on their own, so the children see other kids similar to them and get benefits of that. The parents get to speak to other parents, grandparents get to speak to other grandparents. The whole thing of when you are on your own and you've got little information, it's I can only imagine that it feels very, very daunting, and at times you feel like you're the only person that's kind of going through it. And I know even sometimes for me, even now, like I'll put something on the Facebook Herbs Palsy group, this, is this anyone else, and there'll be umpteen people, oh yeah, that happens to me, or I get this. And you think, oh yeah, that's reassuring to know. So that kind of support you get from the others is really important. They have really good resources. So we've said about kind of the physiotherapy and everyday activity resource. There's a really good, I did contribute to it, so even if I do say so myself, but there's a really good teenage and young adult resource kind of booklet that goes through lots of different information and aids and adaptations. When you get to the tricky years where you start becoming more independent and you need to kind of know, what's out there, kind of aids and adaptations, or just advice or different ways to do it. So that's there. And again, there's lots and lots of different information and resources. And they just start up to date with the best advice that there is. They attend all the international conferences. So the group itself, I forget what they call. They were a committee. What are they now? They're
trustees. Trustees.
Yeah, so the board of trustees are all really knowledgeable about it, and they've all got a connection to it, whether they're a parent or they work in the field. So, to get any kind of best advice and up-to-date advice, they're the ones to go to, really. And they're all very lovely people.
I hope that the people watching will agree that we've covered a very wide range of practical issues. And so we hope it is of real help to people with Erb's palsy and their families. So it remains for me to thank very much Kim Hawksby of the Erb's Palsy Group, Susan Filson, our expert physiotherapist, and David for all of their helpful insights.